There was a really nice article or feature on 10/11 last night on the LPD having increased mental health calls. Thank you for reporting this. As you know, when we had Dr. Dave Myers up here talking about it, that is a real issue. I would just like to, for anybody that is listening, direct people to bryanhealth.com. If you click Care and Treatment, you can click Mental Health Services. There is screening information, contact information, tips, and so forth. I think it's really, really important right now. So what the Lincoln Police Department is facing is real. I share this not to be kind of braggadocious, but Bryan has a long history with mental health treatment. We're the only medical center in Nebraska, frankly, most of the Midwest, that has both in and outpatient substance abuse and mental health care. Goes back to the roots of Bryan Memorial and Lincoln General. Frankly, Lincoln General was one of the first ever to provide inpatient psychiatric care in the country. So a long, proud tradition that we will always remain committed to. For obvious reasons, many others don't, because it's a tough thing from a revenue expense perspective, but so important to our community. So thank you for the coverage on that. And anybody listening, if you know people who are struggling, by all means, direct them to our site or the many other resources in our community. I have John with me today, the Chief Executive Officer of Bryan Medical Center. We'll cover our daily testing statistics, what's going on in the house, and then there are a lot of advanced questions related to our mobile clinic and CREAT, and we will cover those after John's remarks. So starting out, midnight census here at Bryan, 374. So I know we had a question on Monday that it was a lower number, and as we said, it climbs throughout the week. That is consistent with pre-COVID days and COVID days continuing. Our Bryan Easy Visit questionnaires that were completed are now at 10,393. Total easy visits, 3,169. And now 1,479 have used the COVID promo code. Testing statistics, obviously, we're ramping up the testing as you've been following along. Total tested now by Bryan at one of our various locations, 2,244. There are now 112 positives, 1,917 negatives, and we have a big pending number. John will talk about some of the volumes we saw yesterday at our drive-through and with our increased in-house capabilities, but we have 215 pending cases as of this morning. So with that, I'll let John share what's going on inside the building.
Thanks, Bob. John Woodrich, CEO of Bryan Medical Center. So to talk about the numbers, we have 4 positive COVID patients in-house. 2 are from Lancaster County and 2 are from outside the county. We have 5 individuals in-house pending results. 3 are from Lancaster County, 2 are from outside. We have 3 individuals that are on ventilators. 2 of those individuals are positive and from outside the county, and 1 is a pending patient from outside the county. We have 3 people in our ICU, 1 in our progressive care, and 5 in our general care. We've been talking a lot about our mobile unit, so we're going to put that at CREAT Area Medical Center tomorrow morning. It'll be there from 8:30 until 11 in the parking lot. We believe we can accommodate about 160 individuals. We ask people to call ahead of time. Call 402-481-5121 to set up an appointment. We will have interpreters there as well. If you do have a mask, please wear it there. If you do not, we will provide one for you, but we have our language, we hope our language areas covered. Some of our signage is in Spanish as well as English, and our forms will be as well to help people maneuver through. We do know that today the National Guard is locating in CREAT. We don't know the location of that yet. They are planning on seeing about 100 individuals. We think with that 100, 160, or whatever potential we see that day, that will give us a good indication of what's happening in that area of the community. And we just look forward to continuing to test people. We're going to make this mobile unit available to them as often as they need it, and also to this community in Lancaster County. So we're working with both health departments. We're taking leads from them as to where they would like to see that mobile unit be. And we're going to be flexible, so if it needs to be there in the morning or in the afternoon, if it needs to be there in the evening, we're going to be working closely with the health departments. I think everybody has realized, if you look across Nebraska, you've seen some of these hot spots generate. We want to make sure that we get this testing done ahead of time. We help educate people appropriately. We make sure that they're quarantining themselves, or that we can go ahead and take action before people get more severely ill. So that's the whole goal behind this as we work with our health departments. And I think we just can't take a blind eye to it and have to realize we have seen a trend happen across this state and in other parts of the country. So we're trying to be proactive with this. I do want to cover another thing that I think was a major breakthrough with our laboratory. We now have a second platform where we can run testing. And what that platform gives us is the ability to result within 1 hour. That's going to be a big game changer in reference to when an individual is coming here and we test and we're waiting for that test result and it's pending. If it's taking a couple of days, we're taking care of that individual and we're using that PPE equipment. If we're able to result within 1 hour and that person is negative, we don't have to take those precautions and burn through that PPE. So this is about sustaining for the long haul. Major breakthrough in this. We will not use this for everybody. We're still going to focus on our inpatients or pendings or potential individuals coming from nursing homes, our first responders, our employees, and individuals like that. So wanted to share that good information with you. I'm very proud of what our people continue to do and focus on how they can service this community.
I would like to add, CREAT is communicating through all of their community networks, through their social media channels. They have a decent following there. And at CREAT, they do everything in both Spanish and English. Additionally, we have been doing and they're implementing some public service announcements and essentially advertising on both Radio Lobo and Telemundo to drive them to the service that will be offered down there. CREAT's important to us, just as important as Lincoln is. We have employees, physicians, and a community that has a Bryan Health facility there. So to us, we see no difference between CREAT and Lincoln. We are obligated to do everything for CREAT that we would be doing here in Lincoln and other communications. Additionally, we touched on it a little bit, but there's some specific language barriers down there that make CREAT a particular concern. And then great article in the paper today, the Lincoln Journal-Star, about the food processing plants. Some of the most significant outbreaks throughout the country have been in the pack plants, and for obvious reasons, it becomes a hot spot for us, or a potential hot spot. Far be it from us to tell them how to do their business, but I think what we would want them to do is make sure that their employees know that there is testing available. Make sure they are educating all of their employees on symptoms, the things that we're all doing, encourage them not to come to work if they don't feel well, but to seek care, and it's okay, and that's the right thing to do. And then how can these employees stay safe? Certainly, I don't know the real working conditions inside a pack plant, but I understand it's close quarters, but certainly when they're not at their place of employment, if it is one of the pack plants, make sure you practice social distancing, good hand hygiene, and so forth. I think as a society, we're duty-bound in Nebraska, as such a large percentage of our population is Hispanic, to make sure we're always doing things in both English and Spanish, because it's a vulnerable population because of the language barrier and the spread of this.
I think our best thing that we can do right now is ask those employers, work with their health department, and allow them to come into these plants or these businesses to give ideas of how to create a safer environment. We know that these plants are essential to continuing to provide food for everybody, but maybe there's a mechanism of what they can do to help. Maybe they won't be able to produce as much as they did on a typical day, but we could create an environment where we're keeping people safe, and that's what we're trying to do, to not witness outbreaks like we've witnessed in other parts of the state. So my encouragement would be work with your health departments, work with the people that could help give you ideas of how you keep people safe. We want you to continue to stay in operation to provide that necessary food that everybody is relying upon, but let's figure out the best way that we could do it to stop the spread. So that would be my advice. The reason why we've been bringing Crete up is we have seen more positives come from that area. And you know, you just look at the trends, and when you start to see that, you say we've got to get more proactive and make an approach to get to individuals. And you know, I believe we probably have that even here in Lincoln, that we have language barriers. And are we doing the best job we could to communicate to these individuals and give them access? And that's what generated the mobile idea, is that we've got to figure out how to get to individuals and make the access as easy as we can. And by working with our health departments, they're helping direct us to what areas of the communities that we need to go to.
Yeah, absolutely. Certainly what's going on in Grand Island, Lexington, Madison, they are Heartland Health Alliance in the area, or certainly communities. And I know that we did receive a call from Dr. Anton earlier today where they will be asking for some relief for what's going on in Lexington. So that's, I guess this is the theme of today's conference is Crete. That would be very similar to some of those communities, and why we have such a vested interest in trying to slow things down there. So we do expect to be seeing some patients coming from communities like Crete that are in the Heartland Health Alliance.
So this 1 hour is a different platform. So it is different than the other one that was a 2.5 hour. In that 2.5 hour, we had to do that in a batch type sequence. So it isn't like as soon as you test somebody or get that specimen that you can get the result in 2.5. They have to be batched together. Otherwise, you're using too much of that equipment. But this other one, you can just run one at a time. So as soon as we receive it, we can run it through. And I believe there's, and I'd have to look at it again, either 6 to 8 pockets that we can do individually. So yeah, this is a big breakthrough that we don't need to batch these, and we can run them one at a time.